Has your vet told you that your dog has a heart murmur? Is it serious? Should you be worried? It sounds pretty scary, right? Maybe your pet seems completely healthy and you had no idea that there was anything wrong. This is a common predicament and a complex topic, and as a veterinary cardiologist, it's obvious that many vets just don't have the time to fully explain what this means. So today, I'll break down what heart murmurs are, what causes them, what you should do if your pet has one. So, the actual cause of a heart murmur can be quite tricky to understand. It's based on the transition of fluid flow from laminar or smooth flow into turbulent flow. I like the analogy of a river. Have you ever looked at a large river flowing past, often at great speed and volume, and noticed just how completely silent it normally is? It's quite remarkable when you think on it that huge volume of flow is moving so quietly. However, as soon as it reaches a constriction or narrowing like a bridge or rapids, suddenly it can become really loud. The physics of this are pretty complex, but basically you get rapid and irregular pressure and velocity changes within the turbulent flow, which generate these sound waves and turn the same amount of flow into a noisy rather than silent flow. So in the same way, a heart murmur is caused by turbulent blood flow in the heart. Anything that affects the smooth flowing of the blood through each of the 4 cardiac chambers and valves and the great vessels can result in a chaotic or swirling motion in the blood. And this changes the flow from silent to noisy. So a heart murmur is an abnormal sound that we hear when we listen to your dog's heart with a stethoscope. Normally, a dog's heart sounds have a steady lub-dub noise. But with a murmur, we hear an additional whooshing or swishing sound added in as well. So for a couple of examples, this is a recording of a normal heart. It's actually quite fast, and that's because it's a cat, but it gives a little example of what a normal heart with its 2 sounds will sound like. And then I'm going to play a recording of a heart murmur that's quite loud, and it's so loud that it's slightly obscuring the other heart sounds. So really all we can hear is the murmur. So this is a really obvious one that is nice and easy for the vets to hear and would usually be thought of as a grade 4 or 5 heart murmur, depending on whether it creates a thrill on the side of the chest. So hopefully that gives you a fairly clear idea of what we're looking out for there. So what causes heart murmurs? There are lots of reasons that you can get a heart murmur. Some are innocent murmurs. This means they're completely harmless. They're often found in puppies. They usually go away as the puppy grows. Other types of benign murmurs can appear in young, fit, athletic dogs, especially when they're a little bit stressed when they come to the vets. Some cardiologists call these flow murmurs. However, murmurs can also be caused by underlying heart disease. This includes congenital heart defects. Some dogs are born with abnormal heart structures, so not all puppies with murmurs should be assumed to have an innocent murmur. Also, leaky heart valves. The most common cause in older dogs, especially small breeds like Cavalier King Charles Spaniels and Chihuahuas, although we see it in nearly all breeds at some time or other, is a leaky heart valve. Also, heart muscle diseases. Larger breeds like Dobermans can develop conditions like dilated cardiomyopathy. And then there's other conditions. Things like anemia or infections can also contribute. Your vet may also have mentioned a grade or level when they heard the heart murmur. This is an estimation of the loudness of the murmur, usually on a scale of 1 to 6. And in general, a low-grade murmur is much less worrying than a high-grade murmur. It can be tempting to get a little bit caught up in the grading, especially when looking for changes over time. But most studies suggest it's quite unreliable. It doesn't match well between different clinicians, and it doesn't accurately correlate with disease severity. So, what signs should you look for at home? Now here's the important part. A heart murmur itself isn't always a problem, but it can indicate underlying heart disease. Often this murmur is like an early warning signal going off, And this is fortunate because many heart conditions are much better diagnosed early. These days, there are options for preventative treatments and surgical fixes for lots of conditions. So, even if your pet is showing no symptoms at all, it is well worth discussing the options with your vet and making sure they're giving it due consideration. However, if your pet is showing any of these symptoms, it is even more important to get them checked out. Coughing, especially at night or after exercise, lethargy or reduced activity, rapid or difficult breathing, especially counting a sleeping respiratory rate and getting a number over 30, fainting or collapse, and decreased appetite or weight loss. Measuring your dog's sleeping respiratory rate is one of the best ways to look out for concerning signs. I'll have an updated guide on how to do this in the description below. Diagnosing heart murmurs. When we detect a murmur, the next step is to determine how serious it is. This can be done in several ways. Usually, an echocardiogram, which is an ultrasound of the heart, is the best way to see how well it's functioning and to find the cause of this murmur. We'll look at this test in a lot more depth in another video. Alternatively, a chest x-ray will measure the heart's size and look at the lung health. Blood tests can be used to rule out other health conditions and maybe to screen for certain markers which can suggest cardiac problems, but they're not really a replacement for these imaging tests. Finally, an ECG may be suggested, which shows the heart's rhythm. Usually this is best if your vet suspects any rhythm disturbances. Of course, it's really important to use your own vet's guidance on this one, as there are so many different possible situations that can apply. My favourite starting point, nearly every time though, is an echo. The echocardiogram provides so much more information than any other test. On the right machine and in the right hands, it's the perfect test for this condition. In fact, an expert echo is able to give a cardiologist a view of every chamber of the heart, watching it move dynamically, which can assess the speed and flow characteristics through every valve and vessel. This assesses cardiac function in all chambers, it measures the size of the heart in all sorts of different dimensions, and it can assess if any of the valves are leaking, which is known as regurgitation, or may be narrowed, which is known as stenosis. So remember, not all murmurs are life-threatening, but early detection is key to managing heart health. Treatment for heart murmurs depends on the cause. Some murmurs need no treatment at all, while others require medication to support the heart function, such as pimobendan, a medication that boosts the heart's pump function. This is a brilliant medication when used at the right stages. It delays ongoing deterioration in the heart and can extend the quality of life. Diuretics reduce the fluid buildup in the lungs, but they're only needed when the heart is really struggling, in a condition known as congestive heart failure. Sometimes these can get used a little too early. ACE inhibitors. These help blood flow more easily and can reduce the heart's tendency to remodel. And this is not an extensive list, but it gives a good indication of the most common drugs used. In some parts of the world now, surgical interventions to fix some of these heart conditions are becoming more possible. These include minimally invasive catheter techniques, usually used on various congenital abnormalities. But there's even open heart surgery now becoming increasingly available, which can fix valvular diseases. Although it's still a rarity, in the UK we're actually lucky enough to have one centre that is pioneering this approach in the Royal Vet College. So, it's important to stress that we've been finding an increasing number of conditions that can be delayed by bringing in medication in the preclinical or asymptomatic phase. And this is why it's usually worth getting a murmur investigated before you see any changes in your dog's health. Getting the diagnosis right is ever more important and usually needs a proper investigation rather than just guesswork. If your dog has been diagnosed with a heart murmur, don't panic. Here's what you can do. Follow your vet's advice on diagnosis and monitoring. In particular, try to get an echocardiogram performed by someone with expertise in this area. Also keep up with regular checkups and heart screenings. Make regular recordings of the sleeping respiratory rate. Make a note of any changes in their energy levels, and ensure that your dog maintains a healthy weight and diet. By staying proactive, you can help your pet live a healthy and happy life And remember, regular checkups are crucial to monitor any changes over time. So in conclusion, heart murmurs can sound scary, but with the right care, many dogs can still lead normal lives. I expect the majority of dogs coming into my clinics to be living for several years still after diagnosis, and some of them even go home with a completely clean bill of health. So, I hope you found this video helpful. Give it a thumbs up, and don't forget to subscribe for more pet health tips. Also, drop a comment if you have any questions about your pet's heart health. I'd love to help.